Hello, welcome everyone. I am Dr. Girish Nelivigi, Urologist and Andrologist from Nelivigi Multispeciality and Urology Hospital in Bangalore. In my previous videos, I spoke on varicocele and also how to diagnose varicocele. In this video, I will talk about a very important aspect of varicocele, that is the treatment of varicocele. After varicocele is detected, the doctor has to decide whether that needs to be treated, and if at all it has to be treated, in what way. It is important to remember that every time we detect varicocele, it is not necessary to treat it, because varicoceles, especially mild varicoceles, are seen in many people without any symptoms. However, if the varicocele is causing pain in the testis and also discomfort in the testis, then there are many treatment modalities available. For a majority of such varicoceles, the doctor will ask you to wear a tight underwear or a scrotal support. This, along with some painkillers or NSAIDs, will help in tackling the pain, and the patient will have good relief. If that is good enough, then the patient can continue with the same treatment. However, if the pain does not go away despite these conservative measures, or if the pain is moderate to severe, then the urologist will decide on advise operative treatment of varicocele. The operative treatment of varicocele consists of a surgery where the dilated or the enlarged veins are ligated and divided. This can be done by various techniques. One is by laparoscopic method or keyhole surgery, where small cuts are made in the abdomen, the veins are approached from inside the abdomen and they are divided. The other approach is by the inguinal approach or by the groin approach, where a small cut of about 2 centimeters is made in the groin, the veins are isolated, they are tied and divided. This surgery, when done by the groin approach, is usually done using magnification. This magnification can be done using loop or by microscope. This helps in detecting the dilated veins better and separating it from other small tubular structures called lymphatics, and also to detect the artery which supplies the testis. Typically, the hospitalization is less than a day, which means you can get the surgery done in the morning and go home late in the evening. It does not need overnight stay in the hospital. The recovery will be in a matter of 2 to 3 days, which means most of the normal activities can be resumed in 2 to 3 days, but strenuous activities like lifting heavy weights or jogging exercises will have to wait for about 2 to 3 weeks. The other reason to operate on a patient with varicocele is infertility. Here, the person is infertile and he has varicocele, but he has no symptoms like pain. Even here, the urologist will advise you surgery so that the semen parameters or the sperm parameters are improved, and this helps in treating infertility. So these are the two methods to treat varicocele. Nowadays, a newer modality of varicocele treatment called venous embolization has come, and this is typically done by interventional radiologist, and it has got lesser morbidity than surgery. However, not many centers do it, and since it's a new procedure, it may take some time to become popular, as we don't know the long-term effects as yet. Now, what are the complications of varicocele surgery? It is a very safe surgery and a minor one. Sometimes there could be a swelling of the testis after varicocele surgery, and this could be because of the formation of hydrocele, which is nothing but a collection of fluid around the testis. However, when we use microscope, the chance of hydrocele formation is less. Another problem with varicocele surgery, again rare, is infection of the testis, and the epididymis is called epididymoarchitis. This can be treated with antibiotics. Now, what are the outcomes of varicocele surgery in terms of improvements in semen parameters? There is about 30% improvement in semen parameters, which means the number of spermatozoa go up, the motility improves, and the chance of fertility improves. So these are the outcomes of varicocele surgery. Thanks for watching this video.